This is the fourth reflective video, part 2. In finishing to answer the second question, as a health professional, there are always patients that are trying to get services or medications for free, or when they're not really needed for those patients. When dealing with these types of patients, I stuck to the facts and do that in urgent care as well. And gathered subjective and objective information, and know that the legal system will weed out people that are not truly in need of the services, and determine who meets criteria for disability money. How did I manage my anxiety, self-doubt, and uncertainty? We had some difficult patients. One being a very verbally abusive, hostile one to my preceptor. This patient was bipolar and was recently released from prison. And while he was in prison, he was on Valium and another medication. When he saw us the first visit, he was very friendly. And then the second visit, he used all of his Valium and obviously wasn't going to get any more Valium because he used it all in a week. So the patient was verbally abusive during this visit and insulting to my preceptor. And she set boundaries, and we continued the visit without any more difficulty. My preceptor, keeping calm and not feeding into the patient's demands, worked in this case. But she's going to talk to the clinical manager about safety of employees and staff with hostile patients when they don't get their way. So there are currently no safety measures in place at the office. Our conversation that we had between my preceptor and I and the staff members relieved our anxiety and self-doubt in these types of situations. And we kind of made a game plan of how we would handle that next time as a team. And I talked with my preceptor about gaining confidence and overcoming uncertainty as I progress in my career. The fourth question is, what understanding and insight did I develop during this clinical experience? Well, after a few weeks, I realized that behavioral health diagnoses and treatments were an ongoing work in progress, and that many times my preceptor would tell me that we're dealing with a working diagnosis, and that the best way to determine the diagnosis is longevity in seeing the patient. I find this to be true because most of the time the patient continues to divulge information the more times we see them, which can change the criteria for diagnosis some. Another thing I've discovered is that over time patients' illnesses can change. For instance, a patient has depression and some anxiety to begin with. Over time she has a circumstance change, maybe an abusive husband or spouse that can lead her into developing panic attacks and PTSD, and diagnoses are always open for change. The fifth question, has reflective practice impacted me as a person, student, or provider? If so, how? I think any time that you can learn from mistakes or evolving knowledge, it's a good thing. In the beginning of this reflective journal journey, we as new learners did not really know what we didn't know. Now it is interesting to look back and to see, so once we have more experience and knowledge gathered, to add to our initial goals as novices. In this situation, this reflective experience was as a student, but I already used this in my practice and will continue to use it in my personal life and as a current provider. And the sixth question, will you continue to use reflection in your future practice? If so, why and how? Well, of course I will. I will continue to use reflection in future practice. It's a way of measuring your goals, and as new psych mental health nurse practitioners, we'll learn a great deal over the first couple years of our practice as we hone our craft. I will set annual goals for myself, such things as a budget, business growth, and particularly how I can make services better for patients and myself. And reflection on these goals in comparison with the outcomes is a good way to learn, grow, and provide great care. Thank you, and this is my last reflective journal. Thank you so much.